Hello everyone. Welcome to Swaminarayan Physiotherapy College, Ahmedabad YouTube channel. Myself Dr. Jeel Trivedi. Today I want to discuss about active cycle of breathing technique. So before moving forward, please click the bell icon, like, share and subscribe our channel to get the notification of our latest update. Now we started our today's topic, active cycle of breathing techniques. First is introduction. We shortly called ACBT is the one way to help you to clear the sputum from your lungs. It is a set of breathing exercise that loosen and move the sputum from your airways, prevent lung infections and reduce the bouts of coughing. Now we see the phases. There are the three phases of this technique. The first phase is breathing control phase, second phase is thoracic expansion exercise phase and third phase is huffing phase. Now we see the typical cycle of ACBT. The first we have to see the position of the patient. The position is either sitting position, sideline or either prone position. The first will be started with the breathing control. It's also called relaxed breathing. Then after deep breathing exercise, thoracic expansion exercise phase. 3 to 5 times we take a deep breath throughout our nose. Then after we go breathing control phase. Then after thoracic expansion exercise phase, again we take a 3 to 5 deeply breath. Then again breathing control phase and then huff. The last phase is huff at the appropriate inspiratory volume, depends of sputum positions. Then again relax breathing after its use after the bronchodilators, and we again repeat the cycle. Most session will be take approximately 10 to 12 minutes. We see the cycle here: breathing control, deep breathing control, again deep breathing control, and last huffing, followed by cough if needed. The breathing control phase. The first phase is breathing control phase. Now we see in it briefly. The period of relaxed breathing. The patient's own rate. It's more active part of the cycle, preferably with the neck and shoulder are relaxed and diaphragm it contracting for inspiration. It assists with the recovery from shortness of breath, fatigue and signs of bronchospasm. The phase should be continued until the person feels ready to progress further. Now we see the second phase, thoracic expansion exercise phase. It is also known as the deep breathing exercise phase, mainly focusing on inspiration. Instruction given to the patients: the breath in slowly and deeply throughout your nose with the minimal necessary muscle use. The maximum inspiration achieved asks the patient to do an inspiration's breath hold for a 3 to 5 seconds before expiration. Now, after hold, ask the patient to do expiration. Repeat the cycle for a 5 to 4 times. Like this: breath in, hold it, and breathe out. Now again see: breath in, hold it, and breathe out. Now we see the third phase, huff, for expirations technique. It is used to move the secretions from your airways and mobilized by the thoracic expansion exercise. Like we previously seen, second phase we mobilize the secretions, and now in this phase we move the secretions from peripheral airway to medium airway and medium airway towards the mouth. Given instructions: take a medium breath in, then breath out with the mild to moderate force. In this technique, glottis should be open. There are three levels of huffing can be taught. The first is small, medium, and third one is large. The large volume inspiratory breath we take is assist in moving the secretion from peripheral airway to medium airway and medium airway towards the mouth. Like we see how to do huff in this image. Okay. Now we see the indications. When we use this technique, the post-surgical. After the surgery, we can use this technique like the CABG surgery. Then second is chronic increased sputum production in chronic bronchitis and cystic fibrosis like conditions. Then third one is acute increased sputum production, poor expansion, sputum retention, bronchitis, atelectasis, respiratory muscle weakness and asthma. Now we see the precautions. We should be take care of the patient in this kind of situation. It is important to consistently assess for the dizziness or increase the shortness of breath throughout the cycle. If the patients feel dizzy during the deep breathing, decrease the number of deep breathing taken during each cycle. Return to breathing control to reduce the dizziness. Inadequate pain control. If patient feel inadequate pain control, bronchospasm, acute unstable head, neck and spinal surgery. We should take care of this situation. Now we see the contraindications. Patient not spontaneously breathing. In head injury patients, the patient are unconscious. Then we can't teach this technique. Then again, patients who are unable to follow our instruction. Like we see in a head injury patients, yeah, traffic accident patients, they sometimes not understands our command. So we can't use this technique. And last one is agitated or confused patients who are confused or not able to understand our commands. Then we can't use this techniques. Thank you.